And now we move on to the last academic event, the Gossamer Centenary Oration, to be delivered by a wizard of heart surgery, Dr. Sudhanshu Bhattacharya, and he is going to talk on Healing Heart, Shaping Minds, My KEM Journey. Dr. Mohan Desai, Dr. Pathak is busy, so may I request you to chair the session along with Dr. Ashwin Mehta. We have very eminent people as chairs. Dr. Ashwin Mehta is a pioneer in interventional cardiology. He has many firsts to his credit. A successful practice of more than 50 years, he continues to be a source of inspiration. A Padma Bhushan and Padma Shri awardee, he has done our nation proud. Ladies and gentlemen, let this stand echo with some applause. Thank you. Dr. Mohan Desai is an eminent orthopedic surgeon and he is also our medical superintendent. He is spearheading the department and now robotic knee transplant has come in KEM. And with that, I hand over to the chairpersons to introduce our speaker.
Thank you, Dr. Neena. It's my great privilege to introduce the orator, Dr. Sudhanshu Bhattacharya. He has served as a full-time professor of CVTS at Seth Medical College and KEM Hospital with a keen interest in teaching for over 10 years before entering into private practice in 1983. He has invented and designed and patented a few surgical instruments, the most important ones being Atrial Retractor for Mitral Valve Replacement and Internal Mammary Artery Retractor for taking down bilateral internal mammary arteries. Dr. Bhattacharya is credited for pioneering the technique of total arterial revascularization with Lima, Rima, Y grafting in a beating heart and has performed over 5,000 cases by this technique since 1998. Dr. Bhattacharya has received many accolades and numerous awards in his illustrious career and has been recognized globally for his contribution and work in cardiac surgery. He has also presented papers in many national and international conferences and has authored many articles in national and international journals. We have our great privilege and pride to have Dr. Sudhanshu Bhattacharya to be an orator for this occasion. I would request Dr. Ashwin Mehta sir to say a few words about this and then we.
This is the most exciting day that I'm here on the centenary occasion of the premier institute of the country. I joined KEM Hospital, GS Medical College in 1957 and cleared my post-graduation in 1965. 1981, I met Dr. Bhattacharya for the first time. And he was being introduced to me by Dr. G.B. Parulkar, and he said, Ashwin, he's a very, very bright surgeon, and you should take him at Jaslok Hospital. And I think the contribution that he has made to the cardiac surgery is totally not at all replaceable. Dr. Bhattacharya is not a perfect, skillful cardiac surgeon, but he is an innovator. And just to say in a lighter vein, one day I met somebody who did not know who I was, and he asked me if I knew Dr. Bhattacharya, and I said, I don't know. He said, your general knowledge is very poor. Dr. Bhattacharya today is a legendary figure, and like as you all, I am also eager to listen to him. Dr. Bhatta.
Distinguished alumni and my friends. Dr. Mehta is our teacher. He has no business actually to introduce me. He is one of the greatest cardiologists in this area. He has been on the other side of the table, and I have tremendous respect for him. Nobody has got the dexterity in the fingers as he has to play around with the cardiac catheter. This, whether I like him or not like him, doesn't make a difference. He is what he is. He is a champion of that. And that's why this gentleman is still in practice and still is most sought after doctor in cardiology. His good words really elevate me to a big pedestal. It is both a privilege and honor to be with you guys today. And this is a place, has been a cradle of excellency. You are hearing the urologist, andrologist, and you could see how much of innovation is done. This hospital, when you get its atmosphere of work, is what makes you feel that one day you have to innovate something, you have to do something. This is a great challenge. This formative years is what influences us to what we are today. You all are very happy, students are very happy today that you are in one of this institution which will really stimulate you to become one of the leading people in future. I had the occasion, and when I return back to this institution today, that ignites my passion of cardiac surgery. I am in absolute profound gratitude to Dr. P.K. Sen, Dr. G.V. Parulkar, Dr. Bhalerao, Dr. Samsi, Dr. Kinare, Dr. Bhatt, Dr. K.G. Nair, Dr. Pinto, Dr. Padnani, and also one of my friends, Dr. Farke, and Mr. Dr. Vasant Seth, and many others. They not only taught us medicine, but they taught us the compassion, perseverance, and made us a humble, and ultimately asked us to be a humble person and a true passion for cardiac surgery till date. At the same time, in this city, Dr. KEM Dastur, Dr. Merji Mehta, and Dr. Shetty and Dr. Nimisha were also building up institutions. They were building institutions in other hospitals, and we were here with Dr. P.K. Sen with this institution. He built up this department with the help of the foundation of Rockefeller's Foundation. And we were always not satisfied. We were taught that you don't be satisfied with success. You have to still improve. You have to still improve. And that there is something better than what you have seen or what you are doing. And that's the reason why you could see here that Dr. P.K. Sen one day also shot up from all these cardiac surgeons to be the fourth man in the world to do heart transplant. It is this institution which did the fourth heart transplant. I was very fortunate to be sent to America and Dr. G.B. Parulkar sent me to America, and he did not say that why should a student become an expert in coronary surgery. He himself was not doing it, but how great magnanimity he had that he sent me to one of the leading surgeons in the world, Dr. Dudley Johnson, to get me trained for for coronary bypass surgery. Of course, as years passed by, I modified many things in making it a non-perfusion, making it a non-beating heart surgery rather than go on heart-lung machine. See how innovative you have to be. The first man to think about the innovation of bypassing the bypass was Dr. Lillehei. He joined a mother's heart to the child's heart and did his open heart surgery. So he was the first heart-lung machine. Today we have a progress in minimal heart surgery, robotic surgery, 3D echoes, and maybe tomorrow we will be very good at the stem cells and how the damaged myocardium can be replaced. It is still in progress, and maybe you people will be one of those pioneers in doing those jobs. I must confess that cardiac surgery is one of the most lucrative branch of medicine. But you should not lose the interaction with the patient. You must regularly take rounds and talk to the patient. Dr. Phadke, when I went into practice, he told me, Bhattacharya, you should sit on the bed of the patient and talk to them. That's how you will develop, and that's how you will get the confidence. That's how he will get the confidence, and that's how you will progress. So human interaction is a must. All the students, irrespective of the caste, creed, of anything of this patient, should develop a human relationship with the patient. The patients, of course, will put you into a high esteem and pedestal, but you don't get that into your head. Be humble all the time, because it is on this failure that you are today standing. On so many failures, so many patients must have lost their life because of your mistakes, and you have learned the art now. And medical education is going to keep on changing, but all what is important is that keep the passion on. Medical education today is at a crossroad with the technology. People think that they can do everything with technology. Not only that, but still most challenging thing would be the AI, and therefore you are likely to be a little misguided by ethical dilemma will always be between genetic engineering as well. I feel that the telemedicine will be another thing which will be again coming in your future. And I would say that today, when I stand in this gathering of illustrious, all doctors, big doctors, I am reminded of Sir William Osler. A good physician treats the disease, and a great physician treats the patient who has the disease. To the students here, I must say that you must dream big, work hard, and never lose the sight of why you have chosen this noble profession, and keep the ethics of this noble profession on. Denton Cooley was once asked, what is the secret of your success? He said, the harder I work, the luckier I become. So that is what we all every day repeat, that the harder you work, the luckier you will become. Dr. P.K. Sen was asked a similar question, and he said, those who dare succeed. So you have to dare to do things. I did that in my revascularization of the heart, that I would do it totally with internal mammaries or taken from both sides. At that time, people used to all the time blame me that why you are putting all the eggs in one basket, because this was a left internal mammary coming and then it was joined with the right internal mammary. The right internal mammary was taken all around the heart. But I kept on doing it, mastered the thing. Every conference I used to talk about Lima Rima Y graft, and people used to tell, why all eggs in one basket? It is amazing that today nobody talks about it. Possibly it is the best way of revascularization. May the spirit of this great institution guide us all. And what the last message I would give is never never cut corners in your life. Thank you very much.
Thank you very much, Dr. Bhattacharya. Yes, it was a talk absolutely dil se dil tak. Let's have some resounding applause, ladies and gentlemen. I will now request our chairpersons to kindly felicitate Dr. Bhattacharya with Shal Shrifar and the oration plaque. Yes, ladies and gentlemen, can we give a standing ovation to Dr. Bhattacharya? Thank you. Please take your seats.